Hi, and thanks again for joining me, Dr. Ben. We're doing the series on our new patient orientation. This is part 3, where we'll be talking about spinal hygiene and really kind of the flow. On the first part, I kind of introduced you to the understanding of chiropractic and how it works with the brain-body communication. The second one, I showed you how to be proactive rather than reactive. Reactive is way late. It means something's showing up. That means you're really behind. So it's easier to stay healthy and maintain your health than chase and try to get your health back. And right here, this is one of our focuses. I want to make sure when we're doing spinal care or spinal hygiene, these are the things you're going to be doing at home, and we talk about them. It's a healthy living lifestyle, right? So eating, we always talk about non-inflammatory foods, especially in your first phase of care. If you're inflamed, if you're acute, you got a lot of pain going on, healthy eating is one of the most important things that you can do while you're under chiropractic care in my office. So make sure that you're not eating inflammatory foods, a lot of sugar, a lot of fructose that could cause inflammatory. We know a lot of grain causes inflammatory response, corn and wheat. So these things should be lowered while we get through the care. We'll talk about exercise because that's our third phase. Our first phase when we'll work with you is really getting you functioning, getting you out of pain, getting your body working again, getting your posture better, whatever your goals are, that's what we'll be working on. We want to make sure you get rest. I always tell my patients there's 3 things that could happen while you're under care. It usually happens in the first phase. Number 1 is the pain gets worse before it gets better. Remember that. Pain gets worse before it gets better. And this is really important to understand. The mechanism behind that is it's very hard to tell what actual bad pain or degenerative pain and healing pain, they don't feel different. So you might feel like, oh, I'm getting worse, where you're actually healing. Okay. Second part of that is your body might feel very tired. Know that your body cannot repair while you're awake. Repair happens while you're sleeping and you're getting good rest. Okay, so that's what we're going to come about, making sure we get good sleep and get good rest. I got to tell you, your mind process has a lot to do with getting better. I've had patients that in their mind they were just committed to their pain, to their suffering, and no matter what we did physically, their mind, their brain that controls everything was really getting in the way. There was some recovery, they were getting better, but they'd lost hope. Losing hope is, I can't control hope. That's on you. You got to know that you're getting better. You got to think that every cell in your body is healing. You got to know that there's a better wisdom inside your body that wants you to be well, probably more than you do. We spend a lot of time trying to really wreck our bodies with the food we eat, what we do to our bodies, how we take care of them. We're really not good to our bodies. So at least make sure that your mind and thought process are good. So when we're talking about spinal hygiene and dental hygiene, we've all been taught about dental hygiene. I mean, we can go back to thinking about it with our parents. Even in schools, we were taught about flossing and brushing probably. We were given this. Why? Because cavities suck, right? They're painful. Root canals aren't fun. Replacing your teeth nowadays has become really easy and more affordable, but it wasn't. So we were trained to take care of our teeth. We were trained to brush our teeth, floss, rinse and do that a few times a day, because back then teeth are really valuable. The other side of that is we were never taught spinal hygiene. Now, if you watch my first 2 videos, you'll understand that our spine controls everything. We can replace every tooth in your body, but we cannot replace every bone in the spine. Not yet. I don't think it's coming anytime soon. So, wouldn't it be sensible that the area of your body, your brain and your spinal cord that controls every single thing should be taken care of? I see people wearing their backpacks, on their cell phones, all of these things. They do high intensity workout. So if you're working in Century City and you're sitting for 10 hours and then you go to a high intensity workout, that's brutal on your body. You might get away with it in your 20s and some 30s, but 40 or 50s, that's going to come and hammer you. Okay, so make sure you watch out for that. So when we're talking about maintenance, chiropractic, about spinal hygiene, chiropractic's number one on your list, right? Yoga, so I would say this, chiropractic, getting to your chiropractor is like getting to your dentist for your checkups, all right? A little bit more frequent because that spine controls your entire nerve system. Two, things like yoga and exercise and stretching, they're great. They're like flossing. They're not going to realign the spine. They help with mobility of the spine, but they will not remove the subluxation. I have not seen it yet. So that's another thing we can do. Massage, acupuncture, these are great adjuncts. I've never seen, we have acupuncture in the office. I've yet to see the acupuncture reverse the cervical curve in the neck and take the pressure off the brainstem. Just haven't seen it. Great, I love it. We have it. It works. I do a lot of the 5 elements in my office, so I'm totally in. But when we're talking structural and central nervous system, it's a different concept. So our goal here is to teach you to take care of your spine. If you have children, I want you to teach your children to take care of their spine, whether it's on an iPad or a cell phone or a laptop or their backpacks, and they should be getting checked. They should be seeing a chiropractor just as they should be seeing a dentist at such a young age to make sure that their teeth are in line. You want to make sure, don't leave it up, please. Don't leave it up to the school nurse. Don't do that. Don't leave it up to like somebody who is not a professional of the spine. Now, you can take them to an orthopedic, but if that's the surgeon and he won't do surgery, you don't left him. Somebody who studies, who mastered the spine and the central nervous system. Chiropractic, right in here in our office, we love to take care of kids. We want to make sure that they stay healthy. My children have been under care since birth, and the reason, no different than dental hygiene, spinal hygiene. They don't have any pain, they don't have any issues. We're going to keep it that way, but they do martial arts, they do Krav Maga, they play basketball, they do all of these things. They got backpacks. I'm making sure when these kids grow up, they're functional, and the teachers can see it in their classroom, and others can see how calm their nerve system is, because they're not acting like, the kids that you see sometimes out and about, just like all over the place. So it's up to you. I can only teach you spinal hygiene and the importance of taking care of your central nervous system, making sure that you're doing healthy living, making sure that you're not waiting for the problem to show up before you start taking. Let me tell you, once something shows up, that means it's been brewing. We got a lot of patients here feel totally, but doc, I feel great. Yeah, I know. How many people you know who felt great? I know plenty who felt great, and a week later they got diagnosed with stage 4 cancer. Stage 4. Felt great. They felt great. I had a 42-year-old who felt great. A friend, not a patient, a friend. Felt great and had a heart attack with his family in the car. All right, so feeling great doesn't mean jack, okay? Doesn't mean anything. You can feel great and have a heart attack. You can feel great and have stage 3, 4, 2, 1 cancer. You can feel great and have a massive tumor in your brain. Doesn't matter. These things take time to build. What does matter is a clear nerve system checked by us in our office for you and your family. So you're going to see a lot of neurodegenerative diseases coming up, and they're going to be bombardment. We can see it now. People are losing their memory earlier. They're getting foggier earlier. They're getting dementia earlier. There's no answer in the medical world other than working really hard to keep this and staying proactive. Thanks for joining me. In my next video, I'm going to be telling you some tips on how to take care of yourself and how to take care of your posture and what to do at home. Thanks again. Have a great day.